Hi there. Today we're going to talk a little bit about medical records and what we can do to better include a little bit of a wider range of folks when we're collecting data on our patients, clients, and even research subjects. So for a long time, we've been nervous in healthcare to even ask patients about their sexual orientation and their gender identity. And that goes for researchers too. A lot of research, large research data sets even, don't include information on sexual orientation and gender identity. And we're really missing a big opportunity to speak with folks about their identities when we don't know the information because we haven't asked. So a couple of suggestions for that. One, change your medical records, whether you're using paper forms or an electronic medical record, to include information on sexual orientation, including questions about partners, if they don't have a partner, on sexual activity that includes same-sex partners, different sex partners, to be more open-ended in your forms and in your line of questioning, because a lot of healthcare providers make assumptions and don't even include questions about sexual orientation or gender identity. So simple questions like, what is your sexual orientation, or how do you identify your sexual orientation? How do you identify your gender identity? We, as patients, can help these conversations along too by asking our providers to include these things on their forms and saying, you may not have asked this, but it's important to me that this be part of your intake forms, because some people might not be as out or confident as I am as a patient. You could say something like that. So the other thing is that some people might not want to disclose their whole identity to their healthcare provider, and that's fine too. So as a provider, if someone says, I'd really rather not talk about that, that's okay too. You can back off with that. But it's always important to, in a non-judgmental and open-ended way, to start those conversations, because without knowing that information, you're not going to get the data that you need to help your patient or client make the healthcare decisions that they need to make. And in terms of research in healthcare, as I mentioned, a lot of large data sets don't even ask at all about sexual orientation or gender identity. So if you're a healthcare-related researcher, please consider putting questions related to sexual orientation and gender identity. Sometimes you'll hear that called SOGI, SOGI, in your data sets. Even if your data has nothing to do with sexual orientation or gender identity, and in fact, especially if it has nothing to do with sexual orientation and gender identity, we need to collect that data as part of standard demographic data in research studies, so that we can continue to make links for LGBT folks about their healthcare and the health that they're in. So it would be important also not to just ask them about sexual partners, but also just their inherent identity, because some folks may not be in a relationship, but it doesn't mean that they don't have an LGBT identity that needs to be disclosed on forms and in data collection. For example, the Nurses' Health Study does include a lot of data. It's one of the largest longitudinal studies, and they do include a lot of data on SOGI identities, so it's a good start, but we have a really long way to go. So please consider adding that to your provider records. Again, in paper, you can just add it easily, and in electronic medical records, there are a lot of new updates and new ways to add in names, pronouns, gender identity, sexual orientation, so that you can really gather the information that you need to help your patients and make the best decisions about their healthcare. Thanks so much for tuning in. Take care. Bye-bye.